Okay, good day, everybody. This afternoon, we have presentations by several residency directors and administrators from the I&M Consortium, which has a primary care focus. This presentation is being recorded. For those who are not available to attend this workshop or this presentation today, it will be made available to the ANMC website. Before starting, I'd like to make sure that everybody please put their mics on mute, and you'll have opportunity to ask questions either through the chat or by unmuting your mic. Let me first start by giving a sort of an overview presentation of what the I&M Residency is all about. Then I will pass it on to our guest speakers today. So again, welcome to all the students at the Washington campus and at the California campus. And this is a presentation for the Institute of Natural Medicine Residency Consortium. This consortium is under the leadership of Dr. Michelle Simon. She's the I&M President and CEO. These are primary care residency focused residencies, which are affiliated with Bastyr University. These are some of the residency sites that are currently in the I&M residency program. As you can see, we have 4 residency directors and administrators that are present. The others are unfortunately not available. You can see we have sites in Washington, Vermont, and even down in California. So this is just a definition of primary health care. This was lifted, of course, from the House of Delegates from the ANP. I'm not going to read through this, but this is just a point of reference of what primary health care is all about. Now, the I&M residency program is a 2-year residency, and it is an expectation that if you're in this residency program, in a perfect world, we would like to have the resident have an exposure about 20% pediatrics, 60% adults, and 20% geriatrics. No one clinic has this ideal patient encounter experience, and we'll achieve this by doing some rotations and preceptorships among the different clinics. Now, the educational component, of course, of the I&M residency starts off with a one-on-one mentorship with your primary residency supervisors. This also includes in-clinic meetings in the form of check-ins, chart reviews, case previews, and reviews. You're also expected to engage in research and scholar activities such as journal clubs. And for those residents that are in their final year and their year 2, you are expected to submit a written case report, which if it's it could be selected for potential publication through the I&M program. As I mentioned earlier, part of the component of the I&M residency is to do some rotations and preceptorships, and this is usually achieved by having the resident rotate with some of the other member clinics. One thing that's unique about the I&M residency program is the fact that every quarter, I&M sponsors its resident academic series, wherein they invite several guest speakers on key topics. An example would be this coming November 12th, we'll have an I&M sponsored resident workshop, which has a focus on urgent care and pain management. At the end of the year, of course, you have your evaluation, and each quarter you also have your evaluation. One of the things that I&M is also interested in is what they call pre-residency and post-residency metrics, which is just to get a sense of how effective was the program before you started and after you started. Now, in terms of responsibility, of course, the key expectation here is that all residents must pass the boards and have an ND license. You have a workload of about 40 to 60 hours per week, and of course, this will vary from clinic to clinic. You're always expected to wear the appropriate professional attire. You have to come in prepared for your patient care shifts. And part of the expectation, of course, perform the appropriate lab and follow-up calls and complete your charts at the same time. And of course, to attend the quarterly academic series. Again, I can't emphasize this so much because in some of the non-INM residencies, you are expected to do some continuing education which are on your own. And the CNME requires that you must do at least 35 CE hours. And for INM, you have already a built-in advantage. So this is something that's free if you're an INM resident. So I think this is a very good benefit that sometimes get to be overlooked by residents in the program.
Yeah, I'd also add real quick, Gary, that we do offer admission to those paid for non-INM, consortium members, and then residents that have gone through the program also get free access to those for indefinitely, so in the future as well after they're a resident.
Thank you, Joshua. Let's see. Of course, in terms of the training site expectations, there's an expectation that you'll be working primarily with your resident supervisor at least 16 hours work week. You'll have regular meetings, as I mentioned earlier, in the form of case discussions, journal articles, and also assigned projects. Expectation is that you have at least 500 primary care contacts, and of course, we would like to make sure that your exposure to procedures are limited to no more than 16 hours and administrative hours to no more than 8 hours. You'll have access to online databases, and of course, you'll have some release time for preceptorships and rotations. Now, training site, of course, is expected to provide a collegial work environment, give you the appropriate contacts. I just put your competitive salary because each site will have its own salary, and it'll depend also if you're in the state of California and the state of Vermont, it'll vary as well. Part of the expectation is that residents will receive some form of health care or health allowance coverage. Professional liability is part of the expectation. You also have a C allowance at 80 hours of paid time off, including major federal holidays. If you have any questions about the program itself, you can certainly come to me. Nicole Baylor is also our primary contact at INM. I put here in this slide the contact information for Nicole. I believe she's on the call as well. And if there are additional contacts down the road, we'll certainly inform everybody. Okay, let's see. Questions so far before I pass on the mic to our first presenter. Any questions from the group?
I would just say to watch out for the people in the waiting room. I've been admitting them as you were talking,
okay,
as they popped in, just FYI. Thanks,
Rashar. Okay, if that's okay. If there are no questions, then let's go ahead and pass on with our first speaker today is Joshua Rentz. He is the administrator of Alpine Integrated Medicine and also one of the main proponents, if you will, of this program. Joshua, take it away.
Hey everybody, how's it going? I'm Joshua Rentz. I am the co-owner and CEO of Alpine Integrated Medicine. I'm going to share my screen here and see if I can show you some stuff. Let's see, like that. Look at that. That's the questions page. You don't need the questions page. We're going back to the beginning. Oh my gosh, look at that. I was editing. So wonderful to see everybody, or have everybody here really quickly. Thank you for checking in on potential residency opportunities. Like I said, my name is Tushar Rentz. I run all of the non-doctor operations here at Alpine Integrated Medicine in Redmond, Washington. This clinic was founded by Dr. Brooke A.Z. Rentz. She has been practicing for 17 years. The clinic's been going for 12. And I came on several years ago with a background in organizational leadership to basically shepherd the growth of the clinic. And I left my previous career, which was in public education, where I taught for 15 years and worked as a principal and school administrator for a brief period before I made the transition to managing the clinic here. And so that's a little bit about me. The clinic itself, like I said, has been going for 12 years. We started just with Dr. Brooke and a partner of hers, and since then we've grown to have 7 doctors working with us, as well as a pretty robust IV therapy suite and acupuncturist and all of the other operations that go into the surrounding clinic. I just wanted to talk a little bit about the residency and what a person might see if an experience if they were doing a residency here. So we're looking at a 2-year residency opportunity here. Right now we have 2 current residents, a first year, Dr. Lindsay Ritchie, who graduated last year from Best Year, and then Dr. Evelyn Lay, who graduated the previous year, is our second year resident. Each of those years has their own sort of dimension and character to them. Broad strokes being the first year is a little bit more mentor oriented and support oriented, whereas the second year moves into a lot more independent work and patient care, obviously with reflection and guidance, et cetera. So yeah, it's a 2-year residency. We're a clinic here in Redmond, Washington, so we're on the east side of Seattle, kind of in a really nice little, I don't know, sort of neighborhood area. It's pretty, a lot of nature out here. It's very pretty outside of the city. So if you can handle the commute to the east side, it's pretty nice. SpaceX just went in across the street from us. So they just built like a bunch of huge warehouses and brought in a huge operation there. And with that came the newest addition to our clinic area, which has been this like armada of food trucks. So we've been really stoked to have new lunch options recently with the arrival of our friends, sponsored by Mr. Musk. Moving on. So Dr. Brooke runs the clinic. She would be the person that you'd be directly mentoring with most of the time. But our other doctors also serve in mentorship roles for the residents in different capacities, depending on their interest. So Dr. Gregory Robertson is our IV director, does our injection therapies, and is a wealth of knowledge. He has run the IV room out at Holistique and at its Sophia Clinic under Klingart when that was still going strong. And so he has a lot of experience with IV therapy, injection therapies, and that kind of thing. Dr. Sabrina Kimball joined us this year, but has been a friend of ours in the clinic for a long time, and her specialty is digestion and GI. So folks that are interested in those fields we'd set up some shadowing with her throughout the course of your residence experience. Dr. Lisa Price is a longtime vet in the naturopathic field. She was part of the 2006 NIH study along with Standish for cancer research and has done a lot of research into the effect of mushrooms on cancer. She has created a pretty cool complementary cancer program that is unique to our clinic, that is a multidisciplinary program that involves a number of different parts of the clinic as a way to support a person's whole health as they're going through their conventional cancer treatments. And Dr. Carpio is someone who is doing a lot of work right now with our men's health. And so people that would be interested in men's health and hormones might do some additional work with Dr. Carpio. Dr. Brooke is a robust wealth of knowledge, and she does primary care a lot, but her major specialty focus is in thyroid work and then with women's health in general and hormone therapies in specific. So if you're interested in that sort of thing, this may be a clinic that you might want to take a look at. And I'll take questions at the end. So if you have any, that I can answer, I'd be happy to do so when that time comes. The expectations that we have of our residents are going to be pretty high. Oh, here, Dr. Brooke, come on, say hi. You got to get on there you go. That's Dr. Brooke. We're in the back office right now. So anyway, the expectations for our residents are, I'm sorry, just one second. Brooke, what do you need? No. Can I get that for you in a little bit? Thank you. Sorry. everybody else is on lunch but me, so now they all have time to like do all the extra stuff that they didn't have time to do when they're seeing patients. Anyway, so the expectations are like you can see in the slides, a 5-day work week with some additional duties in terms of, you know, research, correspondence, that kind of thing outside of clinic hours. Significant patient contacts, both as the primary doctor and as medical support. And we kind of work that on a pretty robust, like a pretty clear schedule. I'll show it to you right now, the current one. So I like put together like a little spreadsheet, and each of the residents for each of their quarters has their AM and PM kind of lined out for what they'll be working on or who they'll be shadowing and mentoring with. So it's something that we try to, you know, to be clear about and have some structure around. A lot of collaboration, communication, and dedication to the clinic, our patients, and the work we do as physicians. So we're looking for someone that is ready to hit the ground running, that is feeling pretty skilled, obviously within the context of being a new physician, and someone who is really ready to hit the ground running and work hard on behalf of the clinic and our patient community, and someone who's able to take initiative and leadership. We function best with people that are self-starters and follow things through. And so while we do some hand-holding, we tend to be on that spectrum of maybe a little less hand-holding. So I don't know how deep we're going with this kind of stuff, but I thought I'd throw out what we're proposing to compensate. We do a base salary of $55K. Then we do kind of some standard benefits with everybody. We have a healthcare stipend of $3,600 a year, so $300 a month healthcare stipend in addition to the base salary that would go to you to buy health insurance on the market at your discretion. We do 2 weeks of paid vacation per year that's accrued, in addition to 10 paid clinic holidays a year. We also have a retirement account matching program that allows you to defer as much as you would like of your wage tax-free into a simple IRA. We would match that up to 3% of your total wage, tax deferred, and with a financial advisor to help kind of manage that. We pay all your license and malpractice. We do a little bit more CE stipend just because in our experience, we end up paying more anyway. So we're just kind of throwing it in there. We do $1,000 plus a year for a CE stipend, and then you get a 50% discount on any in-house stuff that we have in the office, supplements, care, whatever it may be, as kind of like an employee discount. As an example of how we might use that CE stipend, this December, we're going as kind of a group to the A4M conference in Vegas for a couple of days to do some training with various aspects of longevity medicine, specifically in this case, probably around hormone therapies, but also potentially around some hyperbaric oxygen. And we're paying for kind of that whole thing. So, you know, flight, conference, hotel, whole thing ends up being a little bit more than $1,000, depending on what we want to do in a given year. So that's the kind of thing you might expect from CE. Yeah, so that's kind of what's up with us. We're looking for the person who's a great fit for our practice. Ultimately, it's entirely possible that, you know, we don't find that person, right? But we are we're encouraging anyone who is interested in a clinic like ours to apply, because we are trying to offer the best possible compensation and mentorship experience that we can for you. And we're hoping to expect really strong results and work product from that person as well. So that's what's up with us. Thank you for hearing me out on that. And if you want to get at us, there's my email address. Does anybody have any questions? I'd be happy to answer any questions you may have. I'll check the chat too. I'm reading a question. I don't know if this is for me. Oh, it is. It's at 12:20. Look at that. Are you currently accepting preceptors for those interested in applying to your residency? That's a great question. Yes, we are. And yes, you should. Typically speaking, Dr. Brooke doesn't want to accept a resident unless they've already come in as a preceptor. So if you are interested in pursuing a residency opportunity with us, I would suggest that you reach out to her. I'll write her email in the chat. There it is. If any other questions, type them, shout them out. Where'd I get this dope sweater? It's my secret. All right. Well, should you have any other ones, feel free to reach out. Happy to chat with whomever. You're welcome, Poonam. Thank you very much for your question. And yeah, at that, I guess I'll turn it back over to Gary.
Thank you so much, Yashar. Up next is our speaker is Dr. Margie Aikeda and Anne-Marie Tenore. Dr. Aikeda is the medical director of Natural Medicine of Seattle, and of course, Anne-Marie is the clinic administrator. So welcome, Dr. Aikeda and Anne-Marie.
Gary, am I full screen?
Let's see.
Is it? Okay, great. I'm Dr. Margie Aikeda, and I'm an owner of Natural Medicine of Seattle. I think my clinic is about to be in 15th year pretty soon. I started my company because I was, interested in starting a business, but I also realized that not everybody should be a business owner. And so I'm actually looking for someone that doesn't really like business. And so a lot of our resident actually stayed, and that's kind of who I'm looking for in terms of residency. I'm looking for good physicians that's really, really, really geeking out about medicine and would love to help people and teach others as well. We are a teaching clinic. We have a lot of students coming through. We have a lot of residents coming through, and we also collaborate really well because all of our doctors are employees, and that's pretty different from the other clinics. And so we all are employees under one umbrella. And so there's very little competition, and we also interrefer a lot. So we currently have 6 doctors, some won, awards, and they've been around for a long, long time. They were all my residents before, and so they all just stayed. So that's kind of what I'm looking for. It feels like a really big family. We do a lot of case studies, case management, even just in a casual lunch break room. So it never feels like you're alone here. And so beyond primary care, we do a lot of men's health. We do pellets. We do, obviously the GI, hormone support, pain management, supportive oncology. And we also have a specialty care for eating disorder because Dr. Menzer is the primary care physician for an outpatient eating disorder clinic. So if someone is interested in that, she might be one of the clinic directors that you want to shadow with. The other unique experiences, aside from the IV care that we do have, we actually offer laser. So we do have some aesthetics on top of, well, I think this is the only clinic that has it in the Seattle area. So if you're ever interested in the night lays, which is for sleep apnea therapy, I think we're the only ones that have that machine. So if you're thinking outside the box and want to learn some really, really, well, it's new to naturopaths, but not really new to, a lot of dentists do that. And that's a cash base. So we are insurance, but we also offer a lot of high-end cash prices to kind of offset the low payments for insurance. What else do we do? So like Jashar said, the structure of the residency is very similar in terms of first year is more, hands holding, and then the second year you're pretty autonomous and similar to AIM. And I think a lot of people are like this. I think a lot of the I&M clinics are where we trust the students or the residents to be autonomous. And so we will be your backbone in terms of having support. You can always ask any one of us for support, but we do expect higher quality, I think, than other sites that might not be I&M because we are all busy. We're not expecting you to answer the phones in the front. So that's how I think the quality of all of our clinics, I think, is that we expect you to be really high quality residents when you come out. And we expect you to be physicians and expect you to be practicing as soon as you come out. And I think that's for all of us because everybody is very busy. Let's see, what else did I want to mention about our, oh, the other thing is because, we're relatively moderate, smaller clinic, we're very dynamic. So we can actually cater some of our education or increase some of the procedures based on what the students' interests are. So, for instance, like 2 years ago, we had somebody that was really interested in, PRP shockwave. So then, we got the machine. And so in terms of like how dynamic we are and how, adjustable and flexible we are in terms of catering to the resident, especially if they're wanting to stay with us and retain with us, that is very open. So it's not just about the 2-year, just like I said, we have space for people to stay. So we want you to make a career out of us, not just a 2-year residency. So if you're just going to be one and done, there's probably other sites that are better for you. We currently are accepting preceptors. We have 4 students that are already interested in our clinic. So if you are, interested in, check out our website. If you're interested in any other things that, we offer, please check us out. And similar to AIM Clinic, we really don't want you to be here if you've never checked us out, because we do accept you to, we want people to be feeling like they belong to us. That they feel a sense of belonging in our clinic, because we haven't really had anybody that felt off that we hired. Let's see, what else? Amory, am I missing anything that you want to say? Best way to find out. Yeah, go ahead.
Oh, I was just going to say, for anybody that's interested in our residency, please just email us. And the best thing that we really do, we offer preceptorships. We have multiple slots open each semester. We also offer some abilities to actually work at our clinic for a few hours a week. We have 2 slots available each time for that. These are the best ways to get to know us. It is a very large decision for residencies, for you and for us. So the best way is to really get into the clinics and get some hands-on experience and see which one's best for you.
And then we're located 2 blocks away from U Village. So we're really in the heart of, we're really close to 5 and 520. So it's easy access to those that are on the east side as well. So we have a lot of patients all over the place. What else is there to say, Anne-Marie? I think that's all I have.
I think we can open it up for any questions as well. All right.
Could I just say real quick that I
Yeah.
think it is a very high compliment to your clinic. Obviously, we know Margie, and this clinic is incredible, and so you should definitely be giving it a really hard look. But the biggest compliment to me is that, like, you have staff that was your residents and they're staying, right? So that should tell you something, right? That should tell you that this is a place to support you, right? I just thought that was really, big.
Thanks, Shachar.
Okay, any questions from our folks that have joined into the conference?
Amory, can you respond to the email question? Thank you.
Okay, looks like if there are no more questions, we'll move on to our next speaker today. Our next speaker is Dr. Tracy McDaniel, who is the medical director of One Sky Family Medicine. And she's here to talk about her residency. Welcome, Dr. Tracy.
Hello, hello. Can you see me? Can you hear me?
Let me just go ahead and put you the speaker view.
You got me?
Yep. Go
Okay,
ahead.
great. Hello, hello. Tracy McDaniel, yep, One Sky Family Medicine. I am a partner of Molly Gray. The 2 of us we own the clinic together, and generally we're usually about 6 providers, 2 of which are the 1st and 2nd year residents. Right now we have somebody just had a baby and somebody else is out on medical leave. So it's, we're very busy right now with fewer providers, but generally it's 1st, 2nd year, and probably 4 of us that are full-time, long-term folks. We have a sweet little clinic and a renovated house in Ravenna, Northeast Seattle. And I think the main thing to know about our clinic is that it is very busy: primary care, women's health, peds, LGBTQIA, primary care. We do a lot of hormone work. Probably half of our practice we just did for our liability. We have to tell them how many peds. So it's probably at least 50% peds. And then of the adults, most of them are women, but certainly not all. So I would say, not a lot of geriatrics, not a lot of men's health. Those are the 2 things that are not heavily emphasized here. But we do occasionally get people who are applying for the residency who have no interest in pediatrics. And I'm just telling you right now, if that's not the case, if you don't love peds, that this is not the residency for you. But if you love kids, and if you've done some of the advanced training, or you're just really interested in true primary care pediatrics and family medicine, we're probably a great place to consider. We see residencies with us. The 1st year resident is really pretty connected to me for the 1st year. And we see, slow day is 6 to 8 people, fast day is 14. But probably an average of 8 to 10 folks a day, about half of them kids. We start right off for the first month is kind of an observation month. I'm shocked at how quickly the residents are learning and pick things up. So as soon as they're oriented, then they kind of start doing more and more on their own. But that first year, a lot of support, a lot of working together. And then like I'll work my schedule and they'll have a kind of a acute parallel schedule and we just go back and forth. But and then we are all upstairs in a shared room, like a bunch of the other clinics that are here talking to you today. So there's a ton of conversation and education and questions and resources and ideas. And it's just actually a super fun way to practice if you love chaos and like kids climbing all over the place. And we give vaccines. We're kind of pride ourselves on being a supportive vaccine environment. So we work with people who do all the vaccines. We work with people who do none of the vaccines and a lot of people in between. And so we like to just make sure that the residents coming in have that kind of openness to dealing with people in different places, because not news to you, I'm sure that's a hot topic and there's a lot of shaming and pressure on all sides. So we need folks who are happy to come join us in our kind of curiosity support, education approach to the vaccine question. We do a decent amount of procedures and like lots of blood draws and B12 injections, IUDs. We do a lot of IUDs, probably several a month anyway. We do intrauterine insemination and a lot of fertility work. Let's see what else, tons of pap smears, just kind of your routine preventive care stuff. We do little minor surgical procedures. We remove things. We don't do many stitches. We remove stitches once in a while. A bunch of us who are there came through the midwifery track. So we have some skills remaining from that some of our newer people don't use. But anyway, lots of newborn care. And yeah, just basically we have a ton of fun. Postpartum. I will also say that we've been in business 20 years this year, just past the 20-year, mine personally. People have come in at different phases, but I love the business part of things, and I'm super happy to share our QuickBooks. And we use Athena for our EMR, so it's like very granular, in-depth, detailed information about how many patients and how much money you make per patient and what is the reimbursement. We're heavily 75% insurance, about 25% cash. We do have I think some of the other clinics too, but we have a non-covered services program where people pay us a small amount of money either monthly or per visit that helps us kind of like stay in the insurance game but be able to stay afloat. So if you're interested in that, you can check us out on our website. Has lots of information there about all of us. We have an MA and a receptionist, so we feel strongly that our resident should be able to answer the phone and do all the things that the MA does and the resident does, but that's not really any time or responsibility unless they both happen to be out. Then we'll ask the resident to step in on those things. We have a dispensary, it's not huge, and the resident doesn't manage the dispensary in our clinic. We don't do any like procedure clinics where the resident is in charge of that thing. It's just whatever people come in presenting. So I think that's what I have to offer, and I can't see anything. Sorry, I'm not making eye contact with you because I'm looking at a blank screen, but are there any questions, or does anybody have anything to add or ask me?
Hey, Tracy, this is Gary. Just a quick question. In terms of rotation between you and Molly, I mean, could you give them an idea in the first year and then in the second year?
Oh, yeah, that's great. So in the first year, the resident is with me 3 days a week and with her 1 day a week, and we have 1 day that is acute stuff or just case management catch-up time or CE or rotations or whatever. And then the second year resident is mostly on their own, and they have 1 day with Molly Gray. So we make sure that the residents are spending time with both of us regularly, and then we have the other people in the clinic if you want to do some shadowing. We came through, this is actually something we got from Molly Niedermeyer, but we both really appreciated in our own training many, many years ago that she used to send us out on consults. So one of the things we'll do is if a patient in the middle of the day comes in and has a respiratory infection and we send them to Children's, we'll send the resident along with them, as long as they're welcome in the place. Yeah. Anyway, it's both of us, but one of us primarily each year.
I think it's really important to emphasize that you're one of the clinics in the INM consortium that really has a strong pediatric population. And, one of the expectations, if you will, if you're really into primary care medicine, is really to have some exposure in peds. So I think that's one of the advantages of your clinics.
Great.
And Tracy, I took the liberty of posting your email address in the chat since you're in the car, but someone wanted to know what the best way to contact you was. I just posted your email.
Perfect. Yeah, we save our next quarter's preceptorships are definitely for people who are interested in the residency program. So if you're interested, make sure to say that in the email. Thanks, Tushar.
Okay, any additional questions from the group? If not, then we'll say hello now to our next speaker, Dr. Sage Wheeler. Sage. Dr. Wheeler is the medical director of Sage Med, and he is here to join us to talk about his residency. Sage, take it away.
Thanks, Gary. Hi, I am also in my car, so hope you'll bear with me. I am medical director of Sage Med, which I founded 12 years ago after my residency with Dr. Brooke Daisy-Rentz. My residency is particularly focused on the men's health, men's sexual health, and regenerative medicine. I also do primary care, and our clinic is heavily invested in primary care. But if that's your passion, this is probably where you'll get the least amount of primary care, to be honest. It's a blend of prolotherapy, PRP injections. We do a little bit of adipose-derived stem cells. I do shockwave therapy and P shots for sexual dysfunction. And we do a lot of hormone therapy. We're a platinum BioT clinic. That means we do a lot of pellets. We are actually the number 10 clinic in the nation for putting pellets in people. So if you're very interested in hormone therapy, we don't just do pellets. That's just our patient's preferred option. That's part of the package for our residents. We offer pretty much the equivalent package of Jashar at AIM. We do $54,000 a year. We have continuing education credit. There is no limit to the credit. You just need to get it approved by me. And if I think it's something that benefits both you and the clinic, I'll pay for the CE for the airfare in your hotel. $400 a month stipend for healthcare. We have a matching IRA fund for retirement if you choose to stay at Sage Med. The type of resident that we're looking for is someone who is interested in innovative medicine and who would like to really pick a niche and develop it. And so it really just depends on the interview process. If you have a passion for something and you think that Sage Med could help incubate that, then you just need to make that pitch to me. So you need to have a business plan developed before you come and do a preceptor with me or start your residency. And if I think it's a good fit, I'll help you make it. So I'll give you some examples. My first resident was Dr. Ashok Bandari. As my practice was really getting full swing with sexual health, my regenerative medicine practice was starting to slow down because I simply didn't have enough time. His vision was to have a regenerative medicine practice. So I essentially gave him my regenerative medicine practice, and he is now very gainfully employed at Sage Med 4 years later. And we helped him get his work visa and stuff. Those darn Canadians keep coming and taking our jobs. My next resident, Dr. Stephen Lebrecht, very interested in primary care. He particularly emphasizes LGBTQ+ care. We do a lot of transgender care. He sees a lot of just very aware and trauma-informed, sexual identity-informed, gender-informed primary care services. So he definitely has a strong niche there, and he's an excellent physician who I also still employ. My next resident was Dr. Janae Ferrante. She's very interested in sexual health. She made it clear she did not want to stay in Washington because, we got lovely days like today. And so she's going to go to Hawaii, and I'm helping her get funds to start her practice in Hawaii. So you can see it's very different outcomes for all my residents. My current resident, Dr. Mickey Bronner, he's very interested in business, and I'm, over the next 2 years, going to be trying to teach him how to run a clinic and potentially open a second stage med location. So your residency can be what you make it. If you have a big dream and you just need someone to help you achieve that dream, reach out to me and come to a preceptor. We can have a little lunch meeting. We can talk about, if your dream is a good one, if it's attainable, and if I can help you attain it. I think that covers everything. Are there any questions? I'm going to open the chat here so I can see.
Okay, any questions from the group regarding any of the presenters and their residency?
All right, I'll put my email in there if you want to reach out to me.
And then really quick, I just wanted to introduce myself. Gary briefly mentioned, I, for the past 5 months, have been kind of handling and taking care of I&M's IRC program. And now I've kind of been switched over to CE primarily. So all of the QASs, the quarterly academic seminars that we offer CE credits at, the one that's in November and February and so on, I kind of oversee those. And then we just hired on Dr. Kevin, who I believe is on the call still. Yep, there he is. So I'm actually going to put both of our emails in the chat just so you guys have them there and you can reach out about any questions you have. Dr. Kevin kind of has a little bit more. He's going to be the overseeing of the entire residency program as a whole. And like I said, I kind of do a little bit more of the continuing education. But both him and I kind of bounce back and forth with one another. And if we can't answer your questions, we can get you to someone who can. So I'm just going to put that information in the chat in case you guys have questions for us about the clinics that you got to see here, or if you want to get somehow connected to any of the other clinics that are in our residency program that didn't get to speak today. So,
Nicole, one of the things that that might be also beneficial is to share the coming QAS, the quarterly academic series. That'll be in a couple of weeks, actually. Oh, no.
Yes.
All right. It's coming up very close. And I think, and for Bachelor students, they're welcome to register. Maybe you can talk a little bit about that.
Definitely. Let me pull up the agenda exactly just so I can tell you the times and what you'll exactly be seeing that day.
Do you want to share your screen?
Yeah, 1 second. Okay.
While Nicole's pulling that up, I would just one final piece of advice that I would offer to everybody, and that is, each of the people that presented today, Tracy and Sage and Margie and myself, we all know each other, right? And we all know each other's clinics very well at this point. And one thing that happened really great for our clinic last year was our resident that we ended up hiring didn't apply to our residency at first. They applied to Sage's residency, and he helped them to maybe see that our clinic might actually be a better fit for them after he met them. And so I would really just highly encourage you to, like everybody said, seek out those preceptorships, not just for knowledge of that clinic, but if you talk to the clinic director about, hey, now that you know me, like where do you think I might apply to? Like what clinic might be a great fit for me based on what you know about me? They might be able to help you because we do know a lot about each other and what our various strengths are.
Great. Thank you, Jashar. Yeah, and like I said, I've been with I&M since March, but I can attest to the legitimacy and the high caliber of all these clinics. So they all help each other out. It's very much a communicative and community-oriented consortium. So they will lead you in the right way. They'll make sure you guys feel comfortable and have the right fit as well as them. That being said, this is going to be the November QAS, so it's going to be 7 CE. We're still figuring out how many general versus how many pain management, but it'll be 7 total. It's going to be on a Saturday. And it starts at 9 o'clock for anyone who's not actually in the consortium. So our QASs will always start for I&M residents with a site director and resident meeting. And we kind of get everyone together and just talk about things. People are able to speak up. We give them information on what's new and upcoming, and then kind of get feedback from them on whatever is going on at that time. But then starting at 9, the first half of our QAS, since it's the beginning of the academic year, we like to give residents an opportunity to get very familiar. So it's a 3-hour virtual session with Joy Hardison, and she actually did this for residents last year, and it worked extremely well. But basically, she runs you through different emergency scenarios, and so you're able to get kind of put on the spot, and suddenly you have to go find different equipment that you might need, check expiration dates. So the first half of it is definitely going to be necessary for you to be at your clinic. And then we have a little bit of travel time. And then one of our lunchtime sponsors is going to be doing a talk. And you actually get CE while you eat lunch, which I think is pretty great. And then our sponsors, we usually have between 3 to 5 sponsors that come to our academic seminars, and they'll be there throughout the entire day. So they set up tables. And at the beginning of our seminars, we give them the opportunity to kind of give a brief introduction about who they are, what their products are, and kind of a synopsis of what they specialize in. And that way, when we have these breaks that you'll see here and here, you know ahead of time where you kind of want to head over to and who you'd like to talk more to. And they're really great. We're picky about our clinics within our consortium, and we also are very particular about the sponsors and the people that we want to represent us and that they want to represent, or they want to represent us and we want to represent them. So very high caliber, wonderful people, and we tend to use their products pretty often. So after the sponsors speak, we have Ashok Bandari, who is local in Seattle, and he's going to be addressing acute and low back pain in primary care. He does a lot of like therapy with athletes and whatnot, pretty well known in the area. So we're really excited to have him. And then we have another interactive presenter coming, and Bill Caradona is going to be doing injection training. And he's actually going to be taking people from the audience who want to volunteer and figuring out where they have chronic pain, and he's going to be doing injection training on the spot there and kind of talking about it, going back and forth and giving a whole debrief. So we're pretty excited about that. And then it adjourns usually between 4:30 and 5 o'clock. After the QASs, we always have a party of sorts. It kind of switches on where it's going to be, but this QAS is going to be on Michelle Simon, who is the president of I&M, on her houseboat. We have really good snacks and food and drinks, and it's also just a really good time to get together with everyone. So definitely recommend coming to the QASs. And you can definitely reach out to me or Kevin in the emails that I put in the chat and ask us any questions about that. You guys are also able to attend, and you're able to attend the after party too, which is also pretty fun. I see there's a few things in the chat. Nice. Yes, so students are also able to come to the academic seminars, students and faculty at Bastyr. So I can reach out to Gary and give him some information to send out to the people who are on the call today. And I can let you know about the rates and whatnot as well. And then I can send a link right now of this is, oh, you don't need to see that, but I'll send you the link to the form to sign up for the QAS if you are interested. So I'll copy this and put it in the chat for you guys as well. Yeah, any questions that anyone has? I'll stop sharing my screen so I can see everyone again.
Yeah, I think the QAS is something that's really, really different. when it comes to other residency programs that are non-INM, because this is an opportunity for not only to learn, but also an opportunity to have some level of community, if you will, with your co-residents. In other non-INM residencies, you tend to only be within your program. Whereas with the INM residency program, there's a community built between the different residents within the consortium. So I think that's one thing that tends to not be emphasized, but I think it's worth it, because whenever I do my check-in calls with some of the residents, they're always asking me, how am I doing? Well, I can only relate to them in terms of how they're doing into their individual residency, but if you're in the INM residency program, you actually are able to communicate with other residents within the program itself. And I believe, Nicole, there also is some quarterly virtual get-together as well among the residents. And is that still ongoing?
Yeah, so the virtual get-together is what happens before the QASs usually. So it happens quarterly, and we try to just do it on the same day, since we already know everybody has devoted their time to going to the quarterly academic seminar that day. We just start it an hour earlier for those within the residency, and that kind of gives them the opportunity to speak about things, catch up. And we also have a resident liaison, Stephen Lebrecq, who Sage actually, he just recently graduated from there, so very lucky to have him. But he kind of oversees the residents and does check-ins every now and then. So even if the quarterly check-ins aren't enough for you, or you have a question or want to meet for any reason, there's going to be someone who is able to do that. And we can get you together with different clinics. Like Jashar and everyone have kind of been saying, the site directors are very much so, they like to work together and they like to help each other out. We do a lot of rotations too. So the first week in December, new residents will go to at least minimum of 5 clinics. So not only are you familiarizing yourself with the clinic that you have chosen, but you're also going to familiarize yourself with other clinics, how they do things. And it's very nice because we all have our own different niches. And so you can kind of go and do a little bit more pediatric work. And then you can work and do hormone therapy. And so it kind of gives you the options to switch things up. So you'll always be able to talk to different people if you need it. We try to provide that option.
Okay, I think it's about time to wrap up. Thank you again, everybody, for joining the call today. If you've got any questions whatsoever regarding the INM residency, I'll encourage the students to email me or email Nicole. We'd be more than happy to answer your questions after today.